John is eating at a restaurant during a night out. Then 3 weeks later he develops a slight fever, his skin begins to turn yellow, urine turns dark brown, and his joints begin to hurt. He is admitted to a hospital and tests are run. The doctors conclude he has hepatitis A, and he is told to go home and rest. 6 weeks later he's at the exact same restaurant living life normally. So what exactly happened here? When John was eating at his favorite restaurant, he actually unknowingly ingested a virus, the hepatitis A virus, transferred from one infected to another through feces, urine, or semen. Huh. Not sure which one of those would get you shot and which would get your restaurant closed. As the virus is ingested, it travels to the liver and it makes its home in the resident hepatocytes, where it begins to replicate through poorly understood mechanisms. Here begins viral shedding, which is when a huge amount of viral load are released, mostly through feces, and hence is the main source of spreading. The interesting thing about this virus is the virus itself isn't toxic to hepatocytes. In fact, it is the immune response to the overwhelming presence of the hepatocytes that damage the cells. We can see this because the viral load is highest before the markers of hepatocyte damage begin to manifest. In fact, when the immune system kicks into high gear, those markers show up. Cytotoxic T cells, natural killer cells, B cells, and both M1 and M2 macrophages all converge in the liver to sort out the virus replication. CD8 T cells in particular are activated by high levels of interleukin 15, probably released by the presence of viruses and mononuclear phagocytes. So what are the markers which help us determine hepatocyte damage? Well, when cells are destroyed, they release their insides, with no consideration for the mess they make. These cell guts leak into the bloodstream and then show up in our blood tests, completely ruining a perfectly good mystery by solving our diagnosis. Unbelievable. We see levels of bilirubin, alkaline phosphatase, and ALT all increase, all indicating a liver disease of some variant. We can then carry out an antibody test to test for hepatitis A. During this time, a fever sets in along with nausea, vomiting, and malaise, and abdominal discomfort. With the damage to the liver, jaundice sets in, and as the bilirubin is removed from the blood, it moves into the urine, which begins to darken. As with all diseases, the best way to reduce death is prevention. There is a vaccine that is available, which is given in 2 shots, the first given protection for 12 months, and then a booster given at 6 months, which extended to 2 years. Being hygienic by removing waste and long-lasting immunity from getting the virus when one is young also gives long-lasting immunity, as well as being given an inactivated virus vaccine before traveling to endemic areas. As you can imagine, having a virus bed being taken up by a person for 6 weeks isn't the best use of hospital resources, so there have also been different trials for antiviral drugs, however nothing definitive as of yet. That's all for this one, guys. I think I'll try something different next time. These kind of videos are kind of redundant and boring, so like and subscribe to see what comes next.